Okay, let's unpack this. Today we're diving into something uh, really important for pet owners, especially if you love dogs. We've got sources on canine parvovirus. People usually just call it parvo.
Right.
And look, it's a scary disease, but it is preventable. Our mission here is to, cut through the noise, get to the core stuff, what it is, how it spreads, and really how you can prevent it. You'll walk away knowing what you need to do to protect your pets.
Absolutely. And what's really striking, I think, is just how common and how tough this virus is. So understanding how it works and how to stop it is, well, it's critical for anyone with a dog.
Right. So beyond just the name parvo, what's the absolute, key thing we need to grasp about what it actually is?
The main insight, I'd say, is this. Parvo isn't just some minor bug. It's a highly contagious DNA virus, and it specifically targets and shuts down a dog's really vital systems. We're talking the gut, the immune response. It does this by attacking cells that divide rapidly. That's why it hits so hard and so fast.
Wow, okay. And how does something that destructive manage to get around? Is it mainly dog-to-dog contact?
Yeah, you're right. Direct contact with an infected dog, or unfortunately their feces, that's the main route. But, and this catches people out, it's also the indirect spread. Think about contaminated stuff like kennels, food bowls, water dishes, even your hands or clothes if you've handled an infected dog.
So it could be on, anything.
Pretty much, it's not just, the obviously sick dog you might see somewhere, a contaminated shoe, someone petting an infected dog, then petting yours. It can travel.
Okay, that leads to something that really stood out from the sources, and honestly, it kind of shocked me. Just how incredibly tough this virus is. Can you explain that? Why is it just, wiping things down enough?
Yeah, you picked up on a crucial point. It is incredibly hardy, really resistant. It laughs off heat, cold, a lot of standard detergents, even alcohol. And get this, it can survive out there in the environment on surfaces for months, sometimes longer, depending on conditions.
No, it's wow.
Exactly. That's why that indirect transmission we just talked about is such a huge worry. It underlines those hidden dangers, doesn't it?
Definitely. So, okay, once this virus gets in, what does that awful impact actually look like? What's the first thing an owner might notice?
Well, after the dog ingests the virus, it moves pretty fast. Symptoms usually show up within about 3 to 7 days. And you'll see things like lethargy, just no energy, loss of appetite, vomiting, often a fever, and then typically severe diarrhea, which very often has blood in it.
That sounds awful. Why is it so dangerous, physiologically speaking?
It's because the virus literally destroys the lining of the small intestine. That means the dog can't absorb nutrients properly, but worse, it allows bacteria from the gut to just leak into the bloodstream. That can lead straight to septic shock, which is basically the body being overwhelmed by infection. Systems start shutting down. It's a real battle inside them.
Just devastating. And it's not only the gut that's affected, is it?
No, you're right. On top of that gut damage, it also attacks the bone marrow. That suppresses their immune system, makes it much harder for them to fight off anything, including secondary bacterial infections. This is why getting to a vet immediately is so, so critical. Severe dehydration and that septic shock are, sadly, common reasons why dogs don't make it if they're not treated.
Okay, so diagnosis, that sounds like it's fairly clear-cut with a fecal test.
Yeah.
But what happens then? Is there a magic bullet antiviral drug?
That's a really important question, and the answer is unfortunately no. There isn't a specific drug that kills the parvovirus itself. Treatment is all about intensive supportive care. It's about fighting the effects of the virus. So, correcting that severe dehydration with IV fluids, balancing electrolytes, those crucial salts and minerals, controlling the constant vomiting and nausea, managing pain, and trying to prevent those secondary infections with antibiotics.
So it's really about supporting the dog while its body tries to fight back.
Exactly. And it often means hospitalization, sometimes for several days, with round-the-clock monitoring. It's really intensive.
Okay, that sounds incredibly full-on and expensive. But let's shift to the good news. There is prevention, right? This isn't inevitable.
Absolutely, and this is the most important message. The single most effective way to prevent parvovirus is vaccination. It's very effective. Puppies need a series of shots, usually starting around 6 to 8 weeks old. It's not just one jab. It's a series to build up that immunity properly.
Right, the puppy shots. So for you listening, what are the concrete things you can do? Vaccinations are number one, obviously. What else?
Strict hygiene. It's absolutely paramount. If you even suspect a dog might have parvo, isolate them immediately from other dogs. And remember how hardy that virus is? Regular cleaning just won't do it. You need a proper disinfectant. The gold standard is usually a bleach solution, typically diluted 1 part bleach to 30 parts water, or another disinfectant specifically labeled as effective against parvovirus. This is about disinfection, not just surface cleaning.
Okay, so let's wrap this up. The big picture seems pretty clear. Parvo is, yes, a really severe, dangerous disease. But, and this is the crucial part, it's highly preventable. Vaccination is key, and rigorous hygiene is your other main weapon.
Exactly. And maybe a final thought for you to consider, knowing how incredibly long this virus can hang around in the environment, maybe on grass, on concrete, surfaces you don't even think about. What does that really mean for places like public dog parks or kennels or even just shared neighborhood spots? And how might that knowledge change the everyday precautions you take?